I'm Anthony Chadwick and just wanted to share with you the way that I examine a dog for a dermatological examination. This is Harvey, one of my very old patients who is a 9-year-old Doberman. Basically, a dermatological examination is always part of a more general examination, so I would expect you to, take a temperature, listen to the heart, check the abdomen, so do a thorough physical examination. But then when we're centering on the actual skin, I start off by looking at the nose. So you can see that this nose is quite depigmented, and also you can see around the eyes that there is some depigmentation there as well, some scale. So we're making notes of all of these things. Then we look at the gums. We can do some capillary refill times. We're looking for ulcers. We check both sides, checking the teeth, of course. And then we open the mouth and we can just look again for ulcers. It's amazing how often I may find something like a dental problem, which obviously, whilst it's not a dermatological problem, I can pass on back to the referring vet. Feeling obviously for lymph nodes, checking the skin as we go down, and then of course we can actually check the feet as well. So you can see that there is a nodule there, that's some sort of probably infection in the feet, and we can just check there. And then on the other side, looking at the pads, looking between the toes as well. Looking at Harvey's side, we can also, of course, and of course as part of the examination, we will also want to look in the ears. If we feel there is any dirt in there, then of course we can use an oroscope. Looking down the sides, we can see that the skin is quite patchy. There's areas of alopecia. These two areas here look as if there may have been a pustule there. This is an epidermal collarette. We can see scale. We're making note of these things. We can see that there's some areas of alopecia there. This is a dog that was previously diagnosed with a follicular dysplasia. So we're looking down the sides. Stand up, Harvey. And then we can also check the skin along the dorsum as well. Quite a lot of scale there, which again we can make note of. Very useful tool for the dermatologist are clippers, which we can again use to get a better look at the skin. And then we should also check around the anus and also around the back feet. Not all patients are as good as Harvey, so you may need to use some restraint, either physical or chemical. But I think it is very important to look at the ventrum, because there have been numerous occasions when, I've spotted things that perhaps have not been spotted before, because the dog that was a bit aggressive has been sedated so that we could look underneath. Sometimes one of the best places to see fleas, if the dog has fleas as well. But you can see by a closer examination, and again you can always clip to make it more obvious, that there is a papular pustular rash here on the axilla, and also in this ventral area, areas of depigmentation, also some hyperpigmentation there. But obviously this is something that we will need to deal with. So clinical examination from tip of nose, ears, around the face, feet, dorsum, ventrum, around the rectum as well, will allow you to make a very, very thorough examination and spot any potential lesions that are there.